This is One on One. Welcome back. We are pleased to welcome to the show Victor Murray, who is Program Director, Care Management Initiative, the Camden Coalition of Healthcare Providers. Good to see you, Victor.
Good to see you, too.
Describe your organization.
Yeah, so the Camden Coalition is a fascinating organization made up of a really mixed buckets of work. We have data, engagement, and then also clinical redesign. When we talk about data at the Camden Coalition, really we use it to drive rich and targeted conversations with providers, community, residents, and also institutions. We also use our data to identify really targeted subsets of the population to address them by means of interventions. When we think about engagement, that's engagement on a number of different levels. And so that's engagement of the community, residents, working with them in the homes, hospitals, across behavioral health, mental health systems. That's also engagement on a policy level as well. And then when we talk about clinical redesign, basically that just means we have to do things differently. The healthcare system as we know it doesn't work and it's not efficient. And so it's more about change management.
Let me ask you, the community of Camden, just two or three of the most significant healthcare challenges people face in this community.
Yeah, so it's a lot of barriers, as you can imagine, when we think about, just Camden in its totality and the social structure that's kind of built up. But if I had to name two, I would probably say one is housing for many of the patients.
As a health issue?
As a health issue.
How so?
Believe it or not. And so housing is really health care. If a person is not housed, then how can they manage their health needs? If I don't have a home with a refrigerator, then where can I place my insulin for my diabetes? And so really it's a core, it's fundamental for persons to be able to address their health needs in an effective manner.
Beyond that?
Housing,
what else?
I would say transportation, just access. Yeah, you smile, believe it or not. Most of us just—
Transportation, a health issue.
A health issue.
Can't get to the health care that I need.
Yeah, access.
So how does your organization, the Camden Coalition of Healthcare Providers, how do you help people who are dealing with housing problems, transportation problems?
Yeah, and so I think it's looking at healthcare in a very broad view. Healthcare is more than just physical health. Healthcare encompasses mental health, behavioral health, addictions, substance abuse, housing, employment, transportation, all of those things that you mentioned. And so I think it's expanding our view of what those things include and the impact that that has on the population that we serve.
But you also work very closely, the Camden Coalition works very closely with, in fact, hospitals, primary care physicians, others. Describe that.
Yeah, and so I think that's some of our most impactful work. Really, for us, it's about communication and collaboration across those systems. When you talk about hospitals, mental health, behavioral health, oftentimes those are very siloed institutions, and information, data isn't allowed to cross across those systems. And so we as a organization deem it our responsibility to make sure that across those organizations, people are communicating and those institutions are communicating so that our patients can be cared for in an appropriate manner.
But how does that actually change the impact of the quality, the care that people get? If hospitals and physicians are talking more and breaking down barriers and sharing information, what difference does that really make?
Yeah, because people are on the same page when it comes to care. And so it's something as simple as our health information exchange. We're using that now really to start case conferencing in a region. So among 5 different hospitals, persons who have extreme behavioral health needs and continue to go to the emergency departments to suffice those needs, those institutions are now using the health information exchange to do case conferencing and to talk more about this population.
Real quick, hotspotting is?
Student hotspotting, yeah. And so that's really looking towards the next generation of healthcare providers. We're working with about 40 different schools across the country. We've touched more than about 600 students. And so basically, we have 5 students from each of these schools that range from med school students, social work students, nursing students, farm students, business students, and they work to target a specific high-cost patient in their community. We provide educational support, TA support, as well as case conferencing so that they can begin to understand what it means to work with a team and collaborate more around this subset of the population.
Final question, how rewarding for you?
Extremely rewarding. You know, I'm from the city, born and raised in the city.
You're born and raised in Camden.
Born and raised in Camden. Yep, my grandma lived right around the corner, actually. And so just to see this work and just to see people progress is really impactful, and it means a lot.
Victor Murray, who is a program director, Care Management Initiative at a terrific organization called the Camden Coalition of Healthcare Providers. I want to thank you for being part of this very special initiative called In Your Neighborhood that we're doing in collaboration with our partners, in fact, at NJTV. This has been One-on-One. I want to thank all of you for watching. Make sure we see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato, In Your Neighborhood, Camden, has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Robert Wood Johnson Foundation, RWJ Barnabas Health, the Russell Berry Foundation, Choose New Jersey, Rowan University, and by Wells Fargo. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.